Good morning, everyone, and welcome to today's presentation. I am Dr. S.K. Singh, and I am pleased to be here with you. Today, we will be discussing the calibration of micropipettes. This is an essential skill for ensuring accuracy and precision in our laboratory work. Over the course of this presentation, I will guide you through the steps involved, the importance of proper calibration, and some best practices. So, let's get started and explore how to keep our micropipettes functioning at their best. A micropipette is an essential tool in the laboratory, helping us maintain hygiene and accuracy during experiments. It keeps pipettes upright, which is important for preventing contamination and ensuring that samples stay pure. Plus, having quick access to it means we can work more efficiently. This device is incredibly precise, designed to measure and transfer tiny amounts of liquid, usually between 0.1 and 100 microliters. That might sound small, but in scientific research, diagnostics, and pharmaceutical work, these tiny volumes are often all we need. You'll find micropipettes used in a variety of fields, from PCR and DNA analysis in research, to blood tests and ELISA in diagnostics, as well as in microbiology and drug development. They are vital for tasks like preparing samples, conducting experiments, and performing accurate diagnostic tests. So, in essence, a micropipette isn't just a small tool. It's a critical instrument that ensures precision, cleanliness, and efficiency across many scientific disciplines. So, let's talk about how to calibrate your micropipette effectively. First, it's important to understand that calibration ensures your pipette delivers accurate and precise volumes, which is essential for reliable experimental results. To start, you'll need a few tools: a balance that can measure to at least 0.1 grams, and some distilled water, since we're working with liquids. The key idea here is to compare the volume your pipette is set to dispense with the actual weight of the water delivered. Because we know the density of water, we can convert that weight into a volume, and then see how it matches your pipette setting. When performing the calibration, make sure to pre-wet the pipette tip to get consistent results, and always hold the pipette vertically to avoid measurement errors. After dispensing the water into the container on the balance, record the weight and calculate the volume. If you find discrepancies between the set volume and the delivered volume, adjustments may be necessary, or the pipette might need servicing. Regular calibration like this is a critical part of maintaining accuracy in your lab work, and it ties directly into the overall theme of ensuring data integrity and reproducibility in your experiments. Micropipettes are essential tools in the lab, and they are designed to be very precise. To make sure they keep working accurately, routine maintenance and calibration are necessary. Calibration, in particular, is about verifying that the pipette delivers the correct volume each time. One common way to do this is using the gravimetric method. Basically, we use an analytical balance to weigh the water that the pipette dispenses. Since water's density is well known, we can confidently say that the weight in milligrams corresponds to the volume in microliters. This means, for calibration purposes, milligrams and microliters are considered equal, simplifying the process. To assess how well a pipette performs, we calculate the standard deviation and the coefficient of variation. These statistical measures help us understand both the accuracy, how close the measurements are to the true value, and the precision, how consistent these measurements are across multiple uses. This process is grounded in the principle that maintaining accurate and precise pipetting is critical for reliable lab results. It ensures that every measurement we make is trustworthy, which ultimately supports the integrity of our entire experiment or analysis. Before pipettes are newly placed into service, it's important to ensure they are properly prepared for use. This means conducting a thorough inspection and calibration to guarantee accuracy from the start. Periodically, pipettes should be checked and maintained, typically on a quarterly basis, or according to the manufacturer's guidelines. Following these recommendations helps maintain their precision and reliability over time. After cleaning, pipettes should be re-evaluated to confirm they are still performing correctly. Proper cleaning is essential for preventing contamination and ensuring consistent results. Anytime a pipette becomes dismantled and repaired, it's a good opportunity to verify its calibration and performance. This helps catch any issues that might affect your assay results. Additionally, troubleshooting assay problems can be an important reason to check and calibrate pipettes. If you notice inconsistent data or unexpected results, inspecting the pipette can often resolve the issue. Overall, these maintenance points, before use, periodically, after cleaning, and during repairs, are all about ensuring accuracy and consistency in your laboratory work. Keeping a regular schedule and following manufacturer guidelines will help you maintain high-quality results and avoid costly errors down the line. Let's go through the essential equipment you'll need for proper micropipette calibration. First, you'll want your micropipettes ready for calibration, ensuring they are clean and in good working condition. An analytical balance with completed maintenance is crucial for precise measurements. Make sure your pipette tips are appropriate for the volumes you'll be measuring to ensure accuracy. Weigh boats are also necessary to hold the samples during weighing. You'll need a worksheet specifically for micropipette calibration to record your data systematically. For the liquid, room temperature water in a clean glass beaker works well, although some labs prefer using peanut oil for specific applications. A thermometer is important to verify the temperature, as it affects water density and, consequently, your calibration accuracy. Finally, you'll want a calculator with a statistical program, a computer with statistical software, or at least a standard calculator to analyze your data. All these tools together help ensure your calibration process is precise, reliable, and consistent, key to maintaining quality in your lab work. Let's talk about the complete calibration process. It involves testing both the accuracy and precision of all the micropipettes we outlined earlier. Now, when we talk about precision, we're referring to how consistent the pipette is when measuring multiple times. The guidelines for acceptable precision are usually suggested by the manufacturer, which you'll find in the pipette's package insert. As for accuracy, it's about how close the measured volume is to the true volume. The acceptable accuracy ranges should also be based on what the manufacturer recommends. To give you a general idea, for pipettes in the 5 to 50 microliter range, an acceptable deviation is about plus or minus 4%. For larger pipettes, say from 51 to 1,000 microliters, a plus or minus 2% deviation is considered acceptable. Understanding these ranges helps us ensure our pipettes are functioning properly, which is crucial for the reliability of our experimental results. Remember, calibration isn't just a routine, it's essential for maintaining precision and accuracy in our work. Today, I want to focus on the calibration process for variable micropipettes. It's important to understand that calibration isn't a one-time task. It needs to be performed at 3 different levels. This approach ensures accuracy across the entire volume range that the micropipette is designed to handle. First, calibration at the lowest volume level verifies that the pipette dispenses the correct small volumes, which are often the most challenging to measure accurately. Then, calibration at the middle volume level confirms that the pipette performs well in the typical range used in most experiments. Finally, calibration at the highest volume level checks that the micropipette can accurately deliver larger volumes. By calibrating at these 3 points, we make sure that the device works reliably throughout its entire capacity, maintaining precision and consistency. This method is crucial because it directly impacts the integrity of our experimental results. Accurate calibration at multiple levels helps us avoid errors and ensures that our measurements are trustworthy. So, in summary, always remember to calibrate variable micropipettes at these 3 different levels, low, middle, and high, to uphold the highest standards of accuracy in your work. Let's take a closer look at the procedure flowchart. This diagram is a visual representation of the entire process, helping us understand how each step connects to the next. It highlights the logical sequence we follow, ensuring nothing is missed. The flowchart is crucial because it clarifies the workflow, making complex procedures easier to grasp. When we follow this flow, it ensures consistency and efficiency in our approach. Remember, each box or arrow on the chart illustrates an action or decision point, guiding us smoothly from start to finish. This visual tool ties back to our overall goal of streamlining operations and improving outcomes. So, understanding this flowchart is key to mastering the procedure and achieving success in our project. Let's start by recording the ambient room temperature, which is important because it helps us determine the water density we'll use in our calculations. Next, place a plastic weigh boat and a pipette tip on the balance and tare the balance to 0. This ensures we're only measuring the weight of the water and the tip. Now, take the pipette and attach the tip, making sure to prouette it with the reagent-grade water at room temperature. Using good pipetting technique, carefully pipette the water into the tip. Once filled, turn the pipette horizontally and carefully remove the tip, taking extra care not to lose any of the water. Place the tip with the water into the same weigh boat and weigh both together. Record this measurement accurately. Repeat these steps 10 to 20 times, or as many times as needed to meet your laboratory's precision criteria. This process helps ensure our pipette calibration is accurate by accounting for variations and verifying consistent volume delivery. Remember, the key points are maintaining good pipetting technique, accurately weighing, and recording multiple measurements to achieve reliable results. Let's walk through the procedure for using pipettes in the 100 to 1000 microliter range. First, it's important to record the ambient room temperature. This helps us determine the water density, which is crucial for accurate calculations later on. Next, place a plastic weigh boat onto an analytical balance and tare it. That is, set the balance to 0 with the boat on it. This ensures we're only measuring the water's weight. Before pipetting, remember to prouette the pipette tip with room temperature reagent-grade water. This step minimizes errors caused by the water sticking to the tip and ensures more precise volume delivery. Then, pipette the water into the tip carefully, using good pipetting technique, smooth, consistent, and controlled movements. Once you've pipetted the water, dispense it onto the weigh boat. Allow the balance to stabilize or equilibrate, and then record the weight reading. It's good practice to repeat this process multiple times, typically between 10 and 20 times, depending on the precision criteria established by your laboratory. Repetition helps ensure your measurements are reliable and consistent. By following these steps carefully, you'll improve the accuracy of your pipetting technique, which is essential for precise laboratory work and valid experimental results. Let's walk through a practical approach to verifying a multi-channel pipette. The idea is to start by checking one channel at a time. I recommend using about 10 data points for each channel, and it's best to do this at 3 different volume settings. This way, we can ensure consistent performance across the entire range of the pipette. Once you've confirmed that one channel is working properly, you can then verify the other channels. For these, you don't need as many data points, fewer will do, and you can focus on just 1 or 2 volume settings. It's really important to check each channel individually because they can develop problems independently of each other. If one channel is off, it won't necessarily affect the others, so thorough testing helps catch issues early and ensures accuracy and reliability across all channels. Overall, this step-by-step verification process helps maintain precision and confidence in your pipetting, which is essential for high-quality results in your work. Let's take a closer look at the calculation process. When we talk about calculations in this context, we're really focusing on how to quantify or measure certain aspects of our data or project. The key points here are understanding the formulas involved, making sure we input the correct values, and double-checking our work for accuracy. It's important to highlight that the calculation isn't just about getting a number. It's about gaining insight. For example, by calculating specific metrics, we can identify trends, assess performance, or make informed decisions. Remember, these calculations connect directly to our overall theme of optimization and improvement. They serve as the foundation for evaluating our strategies and ensuring we're moving in the right direction. So, mastering these calculation techniques is crucial for reliable analysis and effective planning moving forward. Let's take a closer look at the concept of precision in calculations. Precision refers to how detailed or exact our measurements or results are. When we're working with data or models, having high precision means we're capturing very fine details, which can be crucial for accuracy. However, it's also important to balance precision with practicality, because overly precise numbers might imply a level of certainty that we don't actually have. In the context of our overall discussion, understanding precision helps us assess the reliability of our predictions and decisions. So, when we talk about precision, think about it as the degree of exactness in our calculations, which directly impacts the quality and trustworthiness of our results. Let's take a closer look at calculation accuracy. When we talk about accuracy in our models, we're essentially measuring how often the predictions are correct. It's a straightforward metric, but it's incredibly important because it gives us a quick snapshot of performance. However, it's also crucial to remember that accuracy alone can sometimes be misleading, especially if we're dealing with imbalanced datasets. For example, if 95% of our data belongs to one class, a model that always predicts that class will have 95% accuracy, but it might not be useful in practice. That's why understanding the context is key. We need to look at accuracy alongside other metrics like precision, recall, and F1 score to get a more comprehensive view of how well our model is performing. In the bigger picture, accuracy helps us evaluate the effectiveness of our algorithms in real-world applications, ensuring that we're making reliable predictions that support our overall goals. Now, let's take a look at the worksheet for Micropipette calibration. This worksheet is an essential tool that guides us through the calibration process step by step. It helps ensure that our micropipettes are delivering accurate and precise volumes, which is crucial for reliable experimental results. As you work through this worksheet, you'll record measurements, calculate deviations, and adjust your pipettes accordingly. Remember, consistent calibration not only maintains the integrity of your data, but also aligns with best laboratory practices. By regularly using this worksheet, you can identify any discrepancies early and correct them, ensuring your pipettes perform optimally over time. This process ties back to our overall goal of achieving accuracy and reproducibility in all our measurements. Now, let's take a closer look at the worksheet for micropipette calibration. This worksheet is a practical tool designed to help us ensure our pipettes are delivering accurate and precise volumes. It typically includes steps for measuring the volume delivered, recording the measurements, and calculating the calibration factor. The key points to focus on here are understanding how to perform the calibration correctly, interpreting the results accurately, and knowing when to adjust the pipette to maintain proper calibration. Remember, consistent calibration is essential for the reliability of our experimental data. This worksheet connects to the overall theme of quality control in the lab. Proper calibration ensures that our measurements are trustworthy, which is fundamental for reproducibility and validity of our results. So, as you work through this worksheet, keep in mind that meticulous record-keeping and precise calculations are your best tools for maintaining pipette accuracy over time. Let's discuss some key procedural notes to ensure accuracy during pipetting. First, avoid handling pipette tips with your fingers whenever possible. Instead, use a lint-free wipe or forceps. This helps prevent contamination and maintains tip integrity. Next, when measuring, always perform 2 readings. It's essential to use 2 fresh pipette tips for each measurement to confirm accuracy. Reusing tips can lead to errors. Regarding evaporation, peanut oil can be quite helpful. Just place a small amount of it in the weigh boat before weighing water. This creates a barrier that prevents water from evaporating during the process. You can use one weigh boat for multiple readings by performing a tare between each measurement. However, if you're doing multiple calibrations, you'll need to empty and re-zero the boat each time. Remember, The balance won't allow you to tear a negative reading, so always re-zero the balance before starting a new measurement. Overall, these steps help maintain precision and consistency in our measurements, which is vital for the integrity of our results. When a pipette doesn't meet the established acceptance criteria for accuracy or precision, it's important to perform routine maintenance before attempting to calibrate it again. This helps ensure it's operating correctly and can deliver reliable results. If a pipette consistently fails to meet these criteria, even after maintenance, it should be removed from service. In such cases, it needs to be serviced either by the manufacturer or an approved vendor to address any underlying issues. On the other hand, if a pipette does meet the acceptance ranges, it's good practice to label it clearly. The label should include the actual accuracy measurement, the date when it was calibrated, and the initials of the person who performed the calibration. Overall, this process is critical because it helps us maintain the quality and reliability of our measurements, which is at the heart of our quality assurance efforts. Properly maintaining and verifying our pipettes ensures we can trust the data we generate and supports the integrity of our work. For further support, please feel free to contact us. We're here to help you with any questions or additional assistance you might need after this presentation. Thank you so much for your attention and engagement today. Remember, we're always available to support your efforts and ensure you have everything you need to succeed.